Hello, everyone, and welcome to Managing Aromatase Inhibitors Tips for Thriving Beyond the Side Effects. I'm Sheridan Murphy. I'm the founder, the executive director, and a proud cancer survivor. I started Each Moment We're Alive Cancer Support Network after my own experience with cancer. When treatments ended, I expected to feel relief, but instead I felt lost. That experience became the seed for this organization. What began as a small gathering of women in a yoga studio has grown into a network that provides survivors with tools, life support, and a community that truly understands life after cancer treatments. Tonight's session is about empowerment, learning to live well while managing the side effects of aromatase inhibitors. These medications save lives, but they can also test your patience and resilience. You're not alone in that. We'll share practical, survivor tested strategies to help you move beyond side effects and into thriving your body, your mind, and your spirit. Before we get into those practical strategies, let's start with a quick understanding of what aromatase inhibitors are and why they matter. Knowing how these medications work helps make sense of what your body's experiencing. It reminds us that every ache, every hot flash, every bit of fatigue comes from your body doing its job to protect you. Aromatase inhibitors are often called AIs. They're a class of drugs that lower estrogen levels in the body. They work by blocking an enzyme called aromatase. That enzyme's job is to turn other hormones called androgens into estrogen. When we block aromatase, estrogen levels drop. These medications are mainly used for postmenopausal women with hormone receptor positive breast cancer, meaning that cancer grows in response to estrogen. By lowering estrogen, we essentially take away the fuel that helps these cancer cells grow. In postmenopausal women, meaning after menopause, a woman's ovaries no longer make much estrogen. Most of it comes from the conversion of androgens in fat and other tissues through the enzyme called aromatase. So, like I've mentioned, aromatase inhibitors step in and block that enzyme. So instead of those androgens turning into estrogen, the process is stopped in its tracks. It's a smart, targeted way to starve the cancer cells of what they depend on. The biggest benefit of aromatase inhibitors is their ability to reduce the risk of cancer coming back. Studies show they can significantly lower the risk of recurrence and even help prevent a new breast cancer from forming in the other breast. They're usually taken once a day, which makes them easier to manage compared to more complex treatments. So, for many women, this medication is a very important part of staying cancer free long term. The most common side effects of aromatase inhibitors mirror menopause, those hot flashes, night sweats, and vaginal dryness. Many women also deal with joint and muscle pain. For some, it's bad enough to consider stopping the drug, so it's important to talk to your doctor about options for relief. Over time, AIs can also speed up bone thinning and raise cholesterol. That's why bone density and heart health are closely monitored. On top of that, there can be emotional and mental effects. Things like fatigue, mood changes, or brain fog. These side effects can be visible or invisible, but they're real. So finding ways to manage them helps people stay on treatment and helps them to maintain a quality of life. There are several aromatase inhibitors approved for use. Keep in mind, research is always improving and new AIs may be on the market. But the three main types, anastrozole, letrozole, and exemestane, are the ones we're going to discuss. Anastrozole is often taken once a day and has been shown to be effective in reducing the risk of cancer recurrence. It's a common choice for many patients undergoing hormone therapy. Letrozole, like anastrozole, is taken daily and it works by lowering the estrogen levels. It's another widely prescribed option and it may be chosen based on specific patient needs. Exemestane is a slightly different type of aromatase inhibitor. It's known as a steroidal aromatase inhibitor and it's also taken daily. But some patients may respond better to exemestane than the other AIs. It all depends on their treatment history and individual needs. Aromatase inhibitors are powerful tools, but they also come with those potential side effects. Like we mentioned earlier, joint pain, hot flashes, and bone density loss. It's important to discuss these with your healthcare provider, as they may be able to suggest ways to manage these side effects or to explore some alternative treatments if needed. These drugs can also cause those muscle and joint pain, and this side effect can be serious enough to cause some women to stop taking the drugs. Tamoxifen and raloxifene are different types of endocrine therapy drugs used to treat or prevent breast cancer. Tamoxifen can be used in both pre and postmenopausal women, and raloxifene is approved only for postmenopausal women. But unlike tamoxifen and raloxifene, AIs tend to speed up bone thinning, which can lead to osteoporosis. But people with osteoporosis are more likely to have broken bones. Because of this, doctors often recommend checking bone density before starting one of these drugs. AIs also may raise cholesterol, so women with pre existing heart disease who take an AI may be at higher risk of having heart problems. So now that we know what AIs are and why they're such an important part of our treatment for many a breast cancer survivor, let's shift into some practical, real world tips for managing the most common side effects of aromatase inhibitors. If you're currently taking these medications or considering them, this section is for you. Remember, what you'll hear next comes from fellow survivors who've walked this road themselves. But always check with your healthcare team before making any changes. They know your history best, and they also play a key role in guiding your care. So, here are some tried and true approaches that can make daily life on aromatase inhibitors a little easier. For joint and muscle pain and bone health, you want to keep moving, but gently. Regular, low impact exercise like walking, swimming, yoga, or Pilates keeps your joints lubricated. Even 20 minutes a day matters. Also, stretch in the mornings. A few minutes before getting out of bed can help reduce the stiffness. Add in warm therapy, warm, hot showers, heating pads, or Epsom salt baths. They can do more than most pain meds for this kind of ache. You can also ask your doctor about anti-inflammatory diets like olive oil, fish, berries, leafy greens. It's all about steady use, not quick fixes. So managing these side effects often means small, steady habits that support the body. Simple cooling strategies can ease hot flashes and sleep issues, like dressing in layers and using fans. Also, limit alcohol and caffeine. They can trigger night sweats. You may want to add some mind body practices, paced breathing, guided imagery, or prayer before bed. These can all calm the stress response that worsens flashes. And don't forget about that emotional care that matters too: rest, honest conversations, and sometimes professional support. These steps can make treatments more tolerable and life more balanced while on AIs. Some of the other side effects could be hair thinning. You know, use a gentle hair care. Avoid harsh treatments like heat styling or chemical processing, and use mild shampoos. You also may want to ask your doctor about supplements or if a biotin or a vitamin B supplement might be appropriate for supporting hair loss. And lastly, gastrointestinal issues. Dietary adjustments. Eating smaller, frequent meals may help with nausea or digestive upset. Stay hydrated. Drink plenty of water. This can help reduce symptoms like constipation. Topics like AIs and other challenges faced by cancer survivors are shared in our weekly support groups. The products listed have been recommended by oncologists. And lastly, our favorite products used by cancer survivors for hand and joint pain are things like sleeping with gloves, lavender, and extra strength, extra pure magnesium spray on the bottom of your feet. Nervine Nerve Care. It's a pain relieving roll on liquid, topical pain reliever, has lidocaine and menthol for your toes, your feet, your fingers, your hands, your legs, and your arms. And also liquid tart cherry for joint pain. This is just one topic of many that usually draws out meaningful conversations and connection in our weekly cancer support groups, especially for survivors navigating life after treatment. Managing Aromatase Inhibitors recording of this webinar is now available in Each Moment We're Alive's resource section, eachmomentwe'realive.org/resources. Stay informed and get exclusive access to our programs, events, and resources for cancer survivors and their loved ones. I want to take the time to thank you all for taking some time out of your day and watching this webinar. I hope you got some little tips and strategies that can help you overcome those aromatase inhibitor side effects. But remember, they're here to save your life. Please follow us on Instagram, on Facebook, both of them with Each Moment We're Alive. Feel free to join our newsletter, stay informed. You can reach out to me at Cindy@eachmomentwe'realive.org. And I hope you have a wonderful day, and thank you very much.